Welcome back to our continued discussion this week. In our time together in the last session, we talked about how a maternal mortality and neonatal mortality birth survey in Hazara, Afghanistan became the catalyst for large-scale social change. And fortunately, these data are recorded in the follow-up book on seed scale by Taylor, and Taylor in 2010. So this narrative is borrowed from their work. And unlike the group at the Community Health Center, this group quantified many aspects of this work. So I'm really excited to demonstrate the power behind this approach and begin to put some quantification around it. So let's talk about expansion and talk about how this model has been used in Hazara to expand women's literacy and improve health outcomes. In our last time together, we summarized at length how the group in Hazara used the process of sustained transformation to build capacity, create vision, and act. And then once they had acted, reflect on the action to subsequently improve what they were doing. So let's talk about what happened. Through that program, with the one woman who had completed 8th grade education and her vision for bringing literacy to other people in her village, she began one literacy program for women, and it was housed in the local mosque. So it started in one village, in one discrete mosque. By the first half of that year, they had expanded to 12 other mosques in the same district. By the end of that year, they had reached 84 mosques in the district. And as they moved past that first year and entered the second year, the mosque-based literacy programs spread to other surrounding districts as well, and even crossed a formidable valley in the mountains, so it spread geographically and numerically. So by the end of the third year, this one woman's vision for mosque-based literacy, who had completed 8th grade, had grown from one program to 483 programs in 3 districts, despite geographic separation. So let's take this approach to partnership-based intervention using the seed scale model and compare it to the top-down only interventions that were funded by and designed by and implemented by government agencies. So the data here in green you've seen in the previous slide, this is the model using partnership, where the community itself is deciding and determining what the intervention is. It's being spread on an as desired basis to other areas who are then customizing the mosque-based literacy program to their specific mosque and community and implementing it among participants who desire it. So you have a partnership between women, between their husband-male partners, between the mosque imam leaders, between the not-for-profit organization and the obstetrician partnering with these women's working groups. So they move from one program to 483. Over the same time, the government program implements 12 literacy programs. So I'd like you to reflect on these data for a moment and see what trends or questions emerge for you. Pause the video and come back, and we'll take a look at a particular aspect in a bit more detail. So here we've zoomed in on the baseline and the 3 years post-intervention period. What I'd like us to notice here is that the trend for the top-down only implementing partner, the government designed, the government implemented program, increased from no programs at the baseline to 12. And so over that 3-year period, they averaged about 4 programs per year that were started. Over the same period of time, the partnership approach started with one mosque-based literacy program and expanded to 438. So in comparison to the 4 per year, the partnership approach generated, on average, 136.5 programs per year. So let's look at some of the dynamics of the cost and the expansion. So the partnership approach used the human energy, the capacity, the desire, the passion, the skills of the communities that they were partnering with. And the cost of that program, so when you compare these costs, the partnership model over the course of 3 years cost $500,000 versus $5 million in the top-down only program. So the cost of the partnership program was only 10% of the cost of the top-down only program. So significant cost difference. When you look at the cost per literacy program, the partnerships program cost 0.2% of the cost of the top-down program. And this cost per unit in the partnership model was $1,140 versus $416,000 per unit in the government top-down only approach. And when you look at the total number of units, the partnership generated 3,650% more units than the top-down approach. And so as we saw in earlier slides, that was 438 versus 12. So the cost is 10% using the partnership model for 3,650% greater yield. So the question is, how does that impact health outcomes? Great, we have literacy programs, but what about some of these cold, hard health outcomes that often our programs are interested in? So let's look at the trickle effect, how it's starting with the community's interest and need, addressing that first, and using that as the starting point for continued action. How did that work? Well, if you look at the pre-workshop period, before the women's only workshops began, there were on average 5.6 under 5 deaths per year in this population, in a population-based comprehensive survey. So after the workshop period, in the period following the workshop and 2 years after, that dropped to 2.5 under 5 deaths per year. So that is a 46% reduction in under 5 mortality using not a direct health intervention, but using engagement, the maternal mortality survey being an opportunity to provide life narrative-based health education that was action-oriented, and then using the collected energy of the women's working groups that came out of the workshops to address female-headed skills in the home to care for under 5 children as well as newborns. So a significant reduction in mortality. So given the cost difference, given the differences in hard measurable health outcomes, the question is, as a health manager, someone making a decision about what approach to use, what would you choose? Look back at the data, download the slides, look at some of the narratives on futuregenerations.org about the work in Hazara, Afghanistan, and you select which approach you prefer. Top-down, guided by a power broker decision maker, or a collaborative partnership approach using seed scale or the model for transformation. So in our next time together, we're going to talk about why. We're going to begin to dissect what happened in Hazara and understand the scale process in a bit more detail so you can begin to apply that to your DNP projects. Again, the focus of spending this time looking at the model and the ways it has been implemented and the impacts that it has is so that you can begin to strategically think about your DNP project, use the principles for sustained collaboration, engage in a transformation process, and think about the scale and expansion and spread of your work from the very beginning. So I am really excited to see what comes of your work using this approach. So come back for part 3 and we'll dissect why there was so much success in Hazara.